Well, welcome everyone, and thank you for joining us on this Saturday morning. Um, Everyone is always interested in the impact of the environment on their health, and I think we've got a lot of different issues going on. The Tijuana sewage is something that we all have been living with for years and years and years. It's become it's gone from an intermittent problem to now a continuous issue that has reached national and international attention. Travelers are coming here, disappointed that they can't access the water, and people who live on the water are worried about the amount of bacteria that can enter into their bodies. So, with that, I'd like to ask Sayonne. I apologize if I mess up your last name, Dr. Sayonne Thihalolipavan or Palavan. He is our county public health officer and in charge of this project or this issue, and very, very knowledgeable on the topic. So, with that, Sayonne, and please tell us more about yourself.
Thank you so much, Dr. Deborah, and thank you everyone for being available on a Saturday morning. Appreciate this and the opportunity. Yeah, my name is Sayonne. I'm your public health officer for a little bit over a year now, but I came in actually 11 years ago to the county from New York City Health Department to be the deputy public health officer under Dr. Wilma Wooten, who was the public health officer at the time, and have had a couple different roles since then. But yeah, I just recently started in here. But I will say that going back to what Dr. Deborah said, or Asha said, when I was deputy health officer in 2015, right, Tijuana River was not on our radar really in terms of or at the health department here. And we are the fifth largest county in the country by population, but it just was not on our radar as much. I mean, we knew what was happening, but we were not actively involved. And I know that many individuals and many communities have felt kind of neglected for that reason, and I cannot blame them. And because I know there wasn't a lot more attention on as there is now. And it really does reflect on this being a chronic, decades long issue, but then kind of an acute on chronic effect where it has definitely gotten worse the last few years. And I know that many of us have noticed. Well, before getting into my slide deck, and I'll take over the screen sharing, um, I just wanted to say that I we had the team pull the data the other day, and up until the beginning of June from 2023, from January 2023 to the beginning of June, Coronado beaches, including that shoreline that's right in front of Hotel Del, was closed for 480 days, 480. So that's more than 1 year of closure, essentially, since 2023 in Coronado. And I will actually be there tomorrow because my parents are here. My dad's here and doing a continuing medical education. He's also a physician up at hotel or down at Hotel Del. And so I'll actually probably be there tomorrow. But again, probably not to probably not enjoying the beaches as much as we want to these days. So there is a and I also, sorry, just want to preface, my parents are here, my kids are here, and so I'm upstairs in a different office, so I know the lighting is not probably ideal, but there's a lot of things going on in this image, and I know I'll just take a little bit of time just for context. I think, everyone knows that this is an issue. Everyone knows that it's a huge issue. Everyone knows that it needs to be addressed, but I don't know if everyone really realizes, and probably this picture doesn't even do the whole thing justice. There is a huge kind of collection and in terms of where the water flows from for the Tijuana River, and that's a broad basin, if you will, and that's not really pictured here. You just see here, and I know it's kind of counterintuitive, but the river runs from south to north because geographically, or to top topography, topography wise, it just the elevation goes lower as it goes from south to north. So there is a reason that it flows in that way, and this is not a river that should be running all year. This is a river that really should only be running when there's water, means during the raining season. And but otherwise, it really should not be running when it's dry season. As you know, as we all know, right? Like this is flowing all year round, and that's not uh, 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 fortunate. That is unfortunate, and really due to the fact that there is a tremendous amount of wastewater. And then, as you'll hear me talk, there's more than just wastewater, and we're still very early in terms of what we know about what really is coming into the and across the border and in the river. And as you see here, the border is this dotted line. I don't know if you're seeing my mouse or not, but that's a dotted line. And so there is impact to residents in Tijuana too. And then I will also say that many of the companies that we are now seeing, and I know some of the research community is, and their wonderful research community is really seeing some of like industrial waste and things like that um, in the river when they're doing their testing. We suspect that's from many of these companies that are down there, and often those companies are there, are they're either serving us or making products for us, or sometimes they're American companies that have other branches down there and things like that. So, and then just to get into this picture again, I know there's a lot going on here. I wanted to show a couple things. One is that if you look down here, uh, hopefully you can see my mouse. This is the regular river, and what happens is that this thing called PVC, this pump station, pulls water out of the river, and then that is what goes to either our treatment plant on our side of the border or the Mexican treatment plants, or may flow into these canyons and canyon collectors and things like that. And so there's multiple pump stations and everything, but it begins with that PVC. And so sometimes what happens is PVCILA gets shut off for various reasons, high, rain events, or it was intentionally off actually for several months from the Mexico side, and they turned it off, and because of that, then there's not as much coming over, or really much coming over for our treatment plant to process, and so that impacts how much is then being left in the river, and therefore flowing untreated into the ocean really directly, and then exposing folks along the way. And then also on the Mexican side, I want to say that this huge plant called San Antonio de los Buenos plant, that one has capacity, I believe, around 17 million gallons per day. And they often get much more than that. So whatever they treat and whatever is not treated goes directly into the ocean as well. And what happens, unfortunately, is that you get these things called south swells, and I know it's south, but it actually flows north. Um, and then sometimes when you get those, it flows north, and sometimes some parts of the year more than others. And I'm not, a weather type of person, so I'm not an expert on this for sure. But in terms of the currents, that is also coming up. And given that, especially many people here are from Coronado, then that will come up to Imperial Beach and then up to you all. And so you kind of getting hit from multiple angles, if you will. And then I will talk about what's called a hotspot, which is more an Imperial Beach Nestor area. And I'll show you in a picture of that too. Uh, and then a lot of this is due to infrastructure issues. And yes, our international treatment plant went from 25 to 35 million gallons per day capacity, but they're planning to go up to 50. There are some other major improvements in the works. There's going to be a whole nother plant, kind of a sister, kind of a copy and paste of the San Antonio de los Buenos next to it. I know there's some other plants. There's also very leaky infrastructure, and they're fixing some of that. So, but all of these fixes, and you can see that, and there's these called minutes and agreements between the U.S. and Mexico side, and that's all public. They all have timelines. You can go to IBWC's website, and you can see all that. But this will take a few years. But while that is happening, this continues to occur in terms of the untreated wastewater and other things flowing, and the population continues to grow in Tijuana, right? We know that there's many reasons and many factors that are contributing to that population growth. And so part of this is not just fixing it for today's population and today's needs, but thinking ahead into what else, right? And the only other thing I wanted to say on this picture is that there's also sediment coming over. So I said sewage, I said industrial waste, and then there's sediment and runoff. And so that does mess with some of the infrastructure. That does also impact some of like the estuaries and the nature, if you will. And so that and then last actually is there's trash. There's a lot of trash, a lot of plastic, and sediment and everything. And so there was actually a trash boom project that was, I don't think I have a picture, but it has been wonderful. And that's a pilot. And I think they're trying to find funding to extend that pilot because it's been so successful in really keeping back at least the large, big piles of trash from entering the ocean. Oh, sorry. And then, like I said, there's more than just sewage. So when you test the water, and the research community who's done this, and good for them, and when they've tested the water, when International Boundary and Water Commission, which is our U.S. Partner that works with the Mexico partners to run the two sewage treatment plants to communicate daily and back and forth, and coordinate on a lot of this wastewater treatment, especially when they test the water, when researchers test the water, they find all types of things. There's actually also pathogens or bacteria and things like that as well. But you see oils, fuels, metals, plastic, drugs, insecticides, detergents, solvents, fire retardants, right? This is whatever people are putting down into sewage, but also because there's industrial waste, we know that there's dumping or illegal dumping likely happening. And then I wanted to say that if you don't know already, my understanding, and maybe limited, and someone please correct me if I'm wrong, is that Tijuana, there's not a separate storm drain system. And so because of that, their sewage system and their storm drain system are one, and it's more vulnerable. It can overflow easier, which has other impacts as well. So, and then and sorry, going back, this is a picture of some of the trash that I was just talking about that you see wash up when there's a lot of flow. And this is the hot spot, and some of you may be aware of this, but this is a Google Earth or satellite view, right? And you can see that white foam right there, and then zoom in into that bigger box, that kind of picture in picture, if you will. That is foam, and what that is caused by, and this is a Monester community area, and this is where we meaning the research community, as well as our air pollution control district, which is our air district for San Diego County, not part of public health or not part of county government, but a separate kind of governmental agency. They are the regulators, and everyone is detecting basically when we look for hydrogen sulfide in the air, which is a byproduct of as waste is decomposed. We know that we see the highest levels by far at the Nestor site. And there's actually an elementary school close by, which is that red triangle, if you will, and around there. And that's where they're detecting the hydrogen sulfide still at very high levels from there. Thankfully, all of everything that seems to be detected usually drops off pretty quickly and lowers, but hydrogen sulfide can still be elevated at certain areas, and even when you go a little bit into the community. And we're still trying to better understand that, which I'll talk about in a little bit. But this foam is caused because there's culverts. So the river was going in, and there was a road created over it decades ago, and there was these culverts, 5 culverts, and they just basically aren't functional. I think only 2 of them were working. And because only 2 are working, you get a lot of water and flow through these 2, which increases the speed. And then there's a huge drop because of there's parts of the culverts that are broken, and then it's a huge drop, and that causes the foaming, the friction. If you can understand, kind of visualize that, if you will, and then there's a lot of aerosolization because of that drop and the friction and the foaming and everything. So we know that is where a lot of gases and other things may be aerosolized there, and people may be most exposed. So we put up signage around there, and then really this is something that's on our side of the border that we are hoping and trying to fix. This is area that is not owned by the county; it's owned by actually the city and the Navy. Depending on the road is the city, and then the kind of waterway, that area is kind of the Navy. So, but we've been working with them. It's just one example. We just got funding and we just got a permit approved last week by the Coastal Commission to do a temporary pipe extension. So this will be a short-term fix while we're trying to get money from other funds to do a long-term fix, which will be two box culverts that look really nice and natural and let more of a natural flow and not a huge drop, and then that foam won't be created. So that's a huge mitigation thinking. Okay, and sorry, and I wanted to go back and say that there's also the Air Pollution Control District right now also has monitoring sites at Imperial Beach and San Ysidro. But again, none of those other two compared to the levels that are seen at Nestor, which is the Berry Elementary School monitoring site. And I'll talk about Coronado monitoring a little bit too. And there's so much again we're learning about the Tijuana River right Valley sewage and pollution crisis, and it's really a local emergency. We at the county have declared this a local emergency since 2023. I know a lot of the cities down in the county and down south have declared it an emergency, many for years and some decades. And so, and we are treating it as such. It's all hands on deck, as you see, and as you know, especially with our board of supervisors is very interested in it, and it's unanimous. There's all five, and it's across party lines, that we know that this is a issue that impacts our regions. We know that no one should be living and next to untreated wastewater and other things that are coming across. And so these are examples of the water flowing out of the culverts and then having that 6 foot drop and causing that foaming. And when you go there, and the researchers, they have to wear full kind of like hazmat gear because there's so much, it smells so bad. I've been down there, and things like N95 that you might have worn during COVID, those aren't really helpful for these. These are a lot of volatile organic compounds and things like that. So, and the concern is that as that aerosolizes, that then migrates into the community. And so, what do we know about the health impacts of the Tijuana River and what individuals are being exposed to? And it's hard to know because it's not just one thing, and it really depends what is in that wastewater as it's coming over. So it may change over time too, right? Like maybe there's more dumping of certain chemicals, industrial chemicals, sometime than another. And then what does that chronic exposure lead to? So what we really probably need is more long-term epidemiology studies and things like that, which we're trying to get some funding for. We have done some health surveys, and then we know, of course, what wonderful providers like Dr. Asha has told us, from what they see from their patients and things like that. But here are two validated federal surveys, partnered surveys that we did in 2024 with the CDC and then with another federal agency called ATSDR. And one was a randomized selection of how at the household level, and then one was a self-report. The self-report is done after, as you see on the right, the ACE study, and that did include Silver Strand Coronado. So while the Casper, the CDC one, did not. But what's crazy about this, or maybe not crazy, but fascinating, is that even though they have totally different methodologies, they actually came to almost very exact same conclusions. And I'm gonna skip over the Casper because that's less, because that's they didn't survey Coronado, but I'll show you how they really are similar. But this is one example, and this is just what people are self-reporting, of course. But we don't think people have reason to report anything wrong. And again, it's consistent. With the A study, we got almost 2,100 completed surveys, and maybe that might have been some of you, and thank you if it was. And so you see here, 64% reported at least one new or worsening symptom, physical symptom that they attributed to the sewage crisis in the past 30 days, with the biggest one being headache, but then runny nose, a lot of kind of respiratory, eye irritation, coughing, nausea, and other things that you see here. And of course, these are just what people are reporting at high levels. And then there's also mental health. And it is really important to know that both surveys showed, CDC one showed 64%, this one showed 65%, feel like their mental health symptoms are related to the sewage crisis, right? And we actually even had clinical scales that you might see in your doctor's office when you get your depression screening, when you get anxiety disorders screening, while you're in the waiting room sometimes or other areas. we did those and issued those were part of these surveys, and we saw that people did respond at higher levels than we would have expected in terms of being consistent with what would be clinical depression or clinical anxiety. And we saw that the people who lived closer or noticed the smell being stronger than others, as they reported in the ACE survey, they had a higher or worse outcomes, basically, or a higher likelihood to be clinically depressed or clinically anxiety. Um, so here's just a summary from the ACE study. We know everyone is concerned about air quality. Surprisingly, most people were also concerned about tap water in both surveys. I think it's hard to know sometimes where your tap water comes from. I know a couple of years ago there was a boil water advisory big after that superstorm that had came, or the hurricane that was downgraded, and then but it's important to know that your public water supply is not associated with the Tijuana River, right? There's no water coming from there that's coming out of your tap. There's no association, and actually our tap water is tested much more frequently and probably more thoroughly than a lot of bottom water supplies, and people don't sometimes realize that. Um, and then and the and then yes, a lot of people noticed the sewage smelling in the preceding 30 days. 57% said it was severe, and those severe folks who said it was severe were more likely to report anxiety or depression or higher rates of um, depression or anxiety in terms of their how they scored those two scales when it compared to the other people who did not say that the smell was severe. So then, surprisingly, also 20, almost a quarter of people reported direct contact with contaminated river or beach water, and this is what we want to avoid, right? We know that one of the best things we could do is not go into the beach when it's closed. We know one of the best things we can do is avoid the hot spot, for example. We know people have ride the horses or run around sometimes along the Tijuana River estuary, and there's some very beautiful areas over there. But unfortunately, we don't want people to actually physically come in contact with contaminated sewage water, just because that could cause skin irritation, rashes, infections, etc. And then I already told you about the others. And this is just showing that really those similarities with this whole nother methodology, this other randomized survey that we did. And then just to wrap it up a little bit is really get to okay, what to do. And I'm happy to entertain questions, of course. But I did think Asha has some other wonderful, important topics as well to talk about. But and I apologize. I know some of this is maybe obvious or not, but and I know we talk about this. Of course, the most important thing is to address the underlying issue. That's what we need to do. So these are just harm reduction steps essentially while we're waiting for the infrastructure issues to be resolved. And so things like keeping the doors and windows closed when you smell hydrogen sulfide, whether you smell it or that it may be elevated because there may be some messaging around about a pipe break, like what happened just, I don't know, within 3 weeks ago, I think. And then, or if you know that it's high, or if you get the text alerts, for example, close your windows and close your doors. And then when you can open it, of course, open it and air out your house. And if you can leave the area, I understand not everyone can always leave the area, or some people not just live there, but work in the area or recreate in the area. So it may be harder, but if you can, of course, yeah, try to leave, right? So less exposure. And then you're at certain higher levels, you actually become you stop smelling it as much because you're just so used to it. And so when you leave the area, it helps you kind of reset your sense of smell a little bit. And then change air filters if you have HVAC systems to HEPA or MERV rated filters. And if you're able to also use filters and air filters with activated charcoal or carbon and potassium permanganate, these are ingredients that really help absorb and trap gases. So gases like hydrogen sulfide and maybe others, right? And then outdoor HEPA indoor filters. So if you're in the eligible area, so if you all are in Coronado, unfortunately, and Dr. Deborah and I have talked about this a little bit. The Air Pollution Control District is giving away free filters, air filters, and we actually, the county, just gave them 4 million more to expand that program or continue it. Um, and while yes, it's at the places that are closest to, along the river, we know that people in Coronado are impacted. We know that people in west side of Chula Vista could still report smelling, the Tijuana River pollution, the hydrogen sulfide and things. So, but they're outside of the eligible area. Your mayor, Duncan, is on the air pollution control district, and but I do want to say that there's an eligible area, and it has to do with the state law that was passed a couple years ago that allows. That's the program that they're tapping into to distribute these filters. So unless that state law gets expanded, unless there's separate funding, etc., the other option is if anyone's on Medi-Cal and has asthma, then there is one other option as well. And then you don't want to burn candles to kind of get rid of the smell or anything, just because candles and indoor burning of anything really may release other volatile organic compounds or VOCs, which can be cause other risks, of course. We also wanted to say that anyone with asthma or pulmonary diseases, and of course I defer to the actual pulmonologist here, should have medications with them. And if you own a business or you work at a business around there, I recommend running your HVAC before opening time, so you're clearing the air so that when people start entering your business, when you open, the air is filtered appropriately. This is what I was referencing with the asthma. If for folks who have Medi-Cal, I know there's a lot on the slide, but just know that if you have Medi-Cal, there is a way, and you have severe or uncontrolled asthma, your insurance plan can pay for an air filter, but it is important again to ask for that one with activated carbon or charcoal, and potassium permanganate. So just like the ones the air pollution control district is currently now distributing, um, to trap gases. So what else can you do? This is a survey that's literally live right now from our Economic Development and Government Affairs office in the county. Not part of public health, but another part of the county. We're huge, as you probably know. And this is an economic impact analysis. So it is really important not just to tell the story of how this is impacting people's health, but also how this is impacting the economy, right? For people who live here, who visit here, who work here, or who own businesses in the area, or any or multiple of those, of course. One example, just because we're coming up on July 4th, the personal anecdote is that my brother, who's from Arizona, who lives in Arizona, um, he was I actually had a reservation last year for in Coronado, for July 4th, and then he ended up canceling it because he was tracking this, and I wasn't even talking to him about this issue. He just saw it in the news and then canceled it because he really wanted to enjoy the beaches, and so then he ended up taking his business, and his family's business up to Orange County instead. So that's just one person or one family, of course, impact. But if that happens enough, that's going to have a huge, of course, domino effect in terms of our local economy. And that's just again one example. So please feel free to click that link. It's in English and Spanish, and share this. We're keeping it open for I think 2 more weeks. Um, and then this is to get real time information, and I'm almost done. This is our environmental dashboard. I just wanted to suggest that if anyone wants to click here, I know there was some issue where the wastewater flow information was coming delayed, and we were working with IBWC, and we're trying to expand this dashboard actually, but it has all types of information all in one place. So this is kind of one of the most popular things on our website, just to see everything at once, whether it's air quality complaints, wastewater flows, hydrogen sulfide levels, etc. So, and then just to say that, we talked about Coronado. We talked about Coronado not having monitoring sites currently from Air Pollution Control District. There's a couple different efforts going on. One that I wanted to highlight is we just gave a contract to UCSD's Scripps Institute of Oceanography and the researchers there, who's also partnering and subcontracting with San Diego State. But this is to really look along the community and not just at those 3 sites, but throughout the whole community. And my understanding is that they are going to also look at Coronado. as well, and see how the levels of hydrogen sulfide, for example, change throughout the whole community, and not just at the monitoring sites, but where people actually live. And with their mobile unit, for example, and other things. So that'll give us a better sense, and also allow us to say relatively, okay, these are lower exposure areas and higher exposure areas. Where else maybe do we need a monitoring site? Where how can we make data-driven decisions? And we want to do additional research studies, like look at health records and things from the past, and pull old records, and then we can compare low exposure versus high exposure areas and see if there's a trend or a dose response in certain health outcomes. So this will help us a lot. But and also see, are there other things other than hydrogen sulfide? We know there's other things in the river. We know there's other things being aerosolized from the river, but we don't right now know that any of those other things are actually entering the community, like where people live. And so this will help us to see if anything is, for the most part. I know, for example, some of these heavy metals, they drop off really quickly when they may get aerosolized, but then they drop off really quickly. So what doesn't drop off? What is another concern? What are other things that people may be breathing day in and day out, especially when there's higher levels of flow, things like that. So that is a huge thing. And this is our main website where there's a lot of things. I'm sure we always can update it a little bit more, but there's a good starting point. So that's it. And I'll pause there. Let me check the chat and pass it back to you, Dr. Deborah. What is San Diego County in charge of testing ocean water north of Alameda? So we do the beach and bay. I don't know, Wendy, if this is, sorry, I'm not as familiar. I need to pull up my map on Avenida Luna, but we do the beach and bay testing. So that's our environmental health program. They collect the water and then we test it in our public health laboratory. So that is a joint partnership. And then that's, if you go to beach and bay, which is also on our environmental dashboard, and where it says things are open or closed, that's based on our beach water testing, looking for E. coli levels, bacteria levels.
Thank you for this amazing presentation. And I'd like to open the floor up to the members that are here, if anybody has any questions, or we can just let you digest all this information, and I'll do a little quick talk, and it probably just a conversation with you and me. We can talk about Ebola and Hanta, but I do have a couple of questions regarding the conversation you just had with us about the sewage. A lot of people love to sleep with their windows open. And I appreciated you saying close the windows, because that's what I've been saying. And I think for a lot of reasons, not just particulate matter, jet fuel, residue that we see in our community, but for the hydrogen sulfide and all of this contaminants. To that effect, I am seeing now more Enterococcus faecalis in respiratory samples when I culture them. And so I just throw that out there to plant a seed for future research. But we are the evidence that you will have in 5 years. We are seeing, as a provider, pulmonary provider for over 20 plus years in this community, there's a pattern change. And so I think what we have to do is keep ourselves safe until this is mitigated. So one thought that I also had is birds as vectors of transmission of sewage content from the river into our community. We have a lot of seagulls around. They come in and swim in our backyard ponds or pools, and I know things are supposed to be chlorinated, but sometimes those levels are modified. So I think that's also another future area, because I'm seeing a lot of ESBL in urine samples, lots of recurrent urinary tract infections, and a lot of resistant bacteria. So that's another thing. And then to your point about the Dell, it was funny last night at an event, somebody mentioned that people are disappointed that they can't go onto the beach, and they're spending up to $1,000 a night to stay at the Dell. So this friend of theirs had went to the front desk at the hotel to complain about that, or ask for a modification of the rate or something. And they said, well, don't you check the water quality before coming here? That was their response. But I think there's going to be an economic
Yeah.
impact. So I just share that with you because what your family mentioned. And then, and but do you have any thoughts about some of the things I've just mentioned? And then I've got one other one.
Yeah, thank you. And you brought up several things, and I see some great questions in the chat too. Is one I did not mention, but when we look at the hydrogen sulfide levels from like the monitoring sites, whether it's our researchers or whether it's air pollution control districts monitoring, it's consistent, showing that it's the evening and overnight hours where it peaks. Meaning, I know, Asha, you said like, people like to leave their windows open when they sleep, but that is when their highest exposures are. So that is the best time to close your windows versus during the day when, we know that there's less exposure. And then the other things, I think that this goes back to kind of the earlier things that I mentioned earlier, that there is so much we still don't know and are still learning and need to learn. But when you don't know what you don't know, that can be very scary. And I acknowledge that. And that should really accelerate and really empower all of us to do more, right? That's why we need to get better control of, and I mean, collectively, obviously, US, Mexico, the larger but we need to address this issue because we don't even know how bad it is yet, I would argue, right? Only recently, and I'd say thanks again to the researchers, do we really confirm that this is not just a water issue, but an air issue as well. Of course, Asha knows that because she sees it in her patients all the time, like you're saying. But it's one thing for one physician to see that in your patients, but then it's a different thing to have a larger set of evidence base. So that's what we need to do more, and on all of those things that you mentioned, whether it's the bacteria levels and things like that. So I think there's a lot.
And
I
I,
know.
I appreciate this because as I've been telling Sayonne is air and water don't follow zip codes.
Yeah.
So, we have to think strategically now. But there's lots more questions stimulated. So, how often is air and water quality tested?
Yeah, water is every day because we close and open the beaches every day depending on the levels. Air is every hour. Actually, air is every minute, but it's reported every hour by Air Pollution Control District because that's just how the regulations require them to report it. The UCSD's, I'll find their website and put in their chat when I get done, but they report it by the minute, so that's why the numbers vary, because when you get a minute average versus an hour average, it'll be a lot higher. But if you look at the actual minute, but Air Pollution Control District, the regulatory body, they have to report it by hour, but they're tested every minute.
Wonderful.
And when
Another
each
good
day,
question is the
yeah,
sand.
yeah.
Is there research on how long the bacteria and chemicals? I know the plastics are forever, but how toxic
Yeah.
is the sand? Can children play in it?
Yeah, that's good. I don't know that I know the answer to that, Wendy. That's a
It's
great question. I
a,
will say
a good
the
research project for
yeah,
UCSD
good
students.
research project. There's a soil testing, some funding for soil testing that I know is now that these Prop 4 funds are out, that I think that's going to be one of the projects, but I don't know if that includes sand. That's a good point.
So,
Let me take that back.
and then I
Um,
think that goes to the next question, walking near the beach for exercise and time of day. Maybe later in the morning instead of early morning.
exactly.
And then, do we know areas of Coronado that are most impacted by the aerosols and open windows? Is there a map for that? And I don't think we have that yet, do we?
We
Or
don't. That's that
yeah.
that study that I said we just funded. That will give us that data. There is one map in one of the studies from the UCSD and STSU team from last year that was published in Science, which is like one of the best journals when it comes to science stuff. The that had a kind of like a modeling of how dispersion modeling. If you want to see that, I can share that in the chat too. But that's not like the actual levels that they recorded throughout. And their modeling showed that that it could have went up to as high as La Jolla. that was in the 2024. There was a heat wave. There was infrastructure fixes. That was when it was a peak, a relative peak. And I did not mention, but at the Berry Elementary School site with that monitor, we have seen elevated levels to a point where there's these EPA thresholds, and it's elevated over their level one threshold, which is still what the EPA classifies as reversible symptoms. But I know people, if you're living right there day in and day out, it doesn't feel reversible because you're dealing with it all the time. Um, but I did want to say there have been some milestones met in terms of surpassing some of the national standards or levels thresholds.
And as for my community, and I my anecdote for all of you, and this is regarding disasters and fires and everything. If you can see, taste, and smell the air, those are your signs to close your windows. And you don't need the data to support that, because there's a lot of other respiratory particulate matter and other things in our community besides the Tijuana sewage. Did somebody have?
There's Yeah, Beth's question, I think that's what we just talked about, and then, but Steve, your question, like prognosis. But on Mexico, yeah, I mean, this is right. It's treat waste coming from Mexico, so it's definitely an international issue. I know that there's a lot of people in Tijuana who aren't able to swim in those beaches too. They're impacted, and then some of them are the maquiladoras, which they call these companies making stuff for us. So I think that's at the federal level, but I know there's a lot of advocacy for the federal government, for our federal government to work more with Mexico and, have higher timelines or faster timelines and, have Mexico commit more money. That was what Minute 333 did. And so I have a couple things to put in the chat when I shut up, but that's one of those I'll put in there, Steve, and that's kind of the most formal document that we have with timelines associated, and there's like a whole project timeline page that IBWC has, but it'll take several years. And again, people just continue to grow there in terms of population, so it'll help. I think time will tell if it'll completely help.
And evidence of waves aerosolizing the bacteria where no one should even be on the beach.
There's definitely bacteria in the air that have been found in sea spray and along the river and things, but um, there has been no research, to my knowledge, at least, showing that the bacteria in the air are making more people sick with that bacteria. Again, that does not mean it doesn't happen. I'm just saying that to my knowledge, there's no. The other thing, for example, like there's meth, like the drug methamphetamine in the sea spray. That was in one of the research papers. But this is a good example, like saying there's like tire, what do you call it, like when you're chemicals that are used to make tires and stuff in there, like stuff. But that doesn't mean everyone like who's being exposed is high, right? Like in South Bay because of the meth in the air, right? So just because it's in the air doesn't mean that it's enough or in high enough concentration we're actually making people sick. Or we don't know, right? Or like maybe it's too small of a dose, or maybe it's not bacteria not alive. We don't know. I think an area for more research for sure.
Wow.
Our visitors. Sorry.
Beth has a question about residents versus visitors, short-term risk versus chronic
Yeah,
exposure.
I would think definitely chronic risk is, um, a longer and more cumulative risk. And please know, even if you don't live in South County, for example, like me, there's exposures of things all the time of other things, right? And our bodies try to do things to clear out some of the things that we're exposed to. But when you're exposed long term and over, years, and even, and I think that's the critical question, especially at chronically low levels, of hydrogen sulfide, even if they're high, sometimes they're generally mostly low-ish. What is the impact of that? And that's where I know we're proposing a long-term epidemiological study. We're trying to get 4 million more external funding to match the county funding so that we can start that study.
I think that's incredible. And it'll be like the one that was done around LAX on asthma and allergies. And I think
Yeah,
looking
yeah.
at chronic sinusitis, allergic rhinitis, asthma, you'll see some really cool data, I think. Now, is the bay affected? I think this is a question we've all had because Coronado's exposed to two bodies of large water, the ocean and the bay. Is that impacted by?
Think as much. Um, yeah, I don't think as much to my knowledge, but I think again, this is maybe where we don't know. We also don't know, just because one beach is closed and then the next one is open, right? Like, does it really go like 100% to zero in terms of bacteria, or is it just like not enough to meet our threshold, right? Like it's usually like how much does it dissipate? And thankfully, the way that we're detecting is better. We're using the best technology. We actually helped validate a technology that's more sensitive, that we can more see bacteria easily, which it makes our all safer for us. And but the it's hard to tell, like, okay, at what point is it really better, and then how far it dissipates and things like that. I will say, in I think I showed you in that first image that in Mexico they don't have an outflow for after they treat the wastewater, meaning it just gets dumped right into that beach, or that area in the water. Whereas here in the Point Loma plant, for example, that we have here, the wastewater treatment plant or our Point Loma treatment plant, they all have, like, they go a couple miles underwater, and then that treated sewage or wastewater is released. So at least it's less likely to kind of impact us directly from the treated wastewater.
So I think that takes care of our final question because it was about piping the waste further into the ocean.
Yeah. And so one of the projects in Minute 333 is for the Mexico one to also do that, where they do it miles underwater and then release the treated wastewater.
Wow, this has been an amazing conversation. I appreciate this. I'm going to just share with all of you a couple of slides, and Sayonne, please stay on for about 5 minutes
Yeah,
more.
and I'm going to put some links in the chat.
Oh, good. Oh, good. And so, right now in the news, there's been a lot of information or concerns about cruise ships and hantavirus, and then also now that World Cup is here, Ebola virus has hit the news. So I wanted to share with you all some information on this topic, and I don't know if you can see my screen. Here we are. So, hantavirus is something we've known about that exists in the Four Corners area of the United States, and it's a common virus that's usually aerosolized by the deer mouse, and it happens when people are just kind of cleaning their garages or see this rat droppings and they sweep it up, and this virus is then inhaled. And depending on the amount of virus and what you've inhaled, it can enter your bloodstream and cause a reaction that ends up in your lungs, and it's called a hantavirus pulmonary syndrome, but it affects your whole body. Think about Gene Hackman's wife. She likely had that, thought she had the flu, had fever, chills, fatigue, headache, but that's about a week. But it can, without any attention, go into a significant life-threatening illness with shock, lack of oxygen, low blood pressure, respiratory failure. What hantavirus does, unlike a common flu bug, is that it affects our bloodstream, and it can cause us to have bleeding. It increases because of the dehydration and capillary leak. We get a high blood count, but low platelet count and an extremely high white count. We have no medicines for this, so early supportive care is important. Most importantly, though, is to avoid rodent exposures. It is something that is human to human transmission that we're just learning about from the South American variant from that cruise ship. If you do see rat droppings, spray it down, don't sweep up or vacuum. And it is a public health reportable disease. Now, in terms of Ebola, I've been getting a lot of questions. A lot of folks have trips planned to Africa, and also some are concerned about, can it come here? As of May, there have been 2,000 cases confirmed. It is something that is commonly seen, not commonly, but we do have periodic outbreaks of Ebola in Africa, sub-Saharan Africa. The good news is compared to a year ago, there have been some increase in recoveries and decrease in deaths due to the recognition, testing, infection control measures. So there's good news, and then there's bad news because we don't have enough medical support in the region. It's a 2 to 21 day incubation period if a person has been exposed, and it's usually by bodily fluids. So it's not just sitting next to somebody who may have it in their incubation period. You get the same kind of symptoms you would as a cold or a flu, sore throat, body aches, headaches, fever, chills. But then it goes into a GI phase with nausea, vomiting, diarrhea, lack of appetite. And then in the later phase, it is very toxic with a high fever, weakness, internal and external bleeding, a rash. It affects your total multi-organ system failure. Early supportive care does help. Mortality can be as high as 90% depending on the amount of supportive care available. It is something that healthcare workers can easily get because they're in close proximity helping virus-infected people. And with the supportive measures, there has been an improvement in mortality, as you've noticed. There are some monoclonal treatments. They're looking at remdesivir, which we used in COVID, because as you can tell, some of the pathogenesis is similar. There is an Ebola virus vaccine, but it's for the Zaire variant only, not the BVD. It's Bundo Bugyo variant right now that's present. And it is definitely a big deal. Psychological support, survivor care are important. The burial practices in the Congo is a source of transmission, and that's a really challenging aspect of this virus outbreak because people like to touch their deceased loved ones prior to burial, and you can't do that, and that's where there's a lot of anguish and transmission of disease further due to bodily fluid sharing. And with that, I'm going to stop share. I'm going to invite Dr. Sayonne to share his thoughts in terms of what the county is looking at on this topic, what kind of we're thinking here in San Diego.
Thank you, Asha. So both things. One, Hanta, thankfully, the local version of hantavirus is not one that spreads people to people. We do detect it in deer mice and other things, so still take the same precautions. And thankfully, none of the folks who were on the ship or contacts to them returned to San Diego. So we did not have to monitor it or anything here, but of course we were prepared if that was going to be the case. And I know some of the folks did return to other parts of California, but not San Diego. And then for Ebola, we actually have had people return to San Diego from other parts of the world who from the exposed where the outbreaks are and things like that. And there's people all around the country that are being monitored. But thankfully, it is not as contagious as like a COVID, and it's a different mechanism of how it spreads, and you need that more closer contact, which is especially because the customs, the burials, like you mentioned, that individuals do get exposed over there, but over here, I know it's less likely, but it's not likely either. We know that in 2014 we had a case of Ebola of a returning physician to New York City. Back there, I was in the incident command system, and I was a medical countermeasures branch chief, and I actually monitored the two of his contacts, of his three contacts. I had to go visit them for 21 days, just while they were in quarantine. But here, locally, our public health lab actually was one of the first three in the country that stood up testing for Ebola. And so we were able to test locally. There was a case actually at another hospital system that was in the news. I'm sorry, it was Sharp, but it was not your Sharp, Coronado. It was a different Sharp. I think I forgot which Sharp, but I want to say Memorial, but where they had a case of someone who they were concerned about, and we did work with them, and we coordinated. It was a good drill, if you will, because it was a very, very low likely, but still someone of concern. And then I know that there's a lot more preparation that we continue to do. We're dusting off and updating our information from 2014, and not everything is the same. We had a hospital here that was already kind of ready to take people. We still have an LA hospital, but Sharp is actually gearing up to be a level 2 hospital because they got a grant and a funding from what's called NETEC at the federal level, but to do that. And so they're actually leading the way locally. But there's a lot of, right, if you think of how people are seen in the healthcare system, there's EMS, emergency medical systems, right? Not when you call 911, who may be first exposed. So we have to make sure they have the protective equipment. We have to make sure the healthcare, if anyone goes to another hospital, that they're able to recognize and identify and isolate and transfer appropriately and things like that. There's so many protocols that we're revisiting. And so we're doing things like, internal meetings all the time, of course, just updating our protocols. We have to share those with our hospital partners and clinic partners. And then we need to do drill this, meaning like do what's called a tabletop drill with our external partners. So there's a lot going on in this space, and we know things like the World Cup. I'm glad you brought that up. These are wonderful events, but we know with more people, even though we do have two teams who are practicing here, we don't have events in San Diego, but we know there's going to be a lot of throughput, and a lot of people are flying into Tijuana or our airport and then driving up to LA, for example, for games, or coming down and leaving from our airport. So we know that we have to be prepared. Someone mentioned NASCAR earlier. That's coming to San Diego County, and that's another thing. So with all of these things, bring some risk in terms of additional communicable diseases or other things like that. I was talking to a district attorney, and she also pointed out that there's more not communicable disease, but there's what do you call it? Like prostitution and things like that, right? There's other things that I think we have to continue to work with our public health and safety partners to monitor and respond to appropriately and try to mitigate wherever we can. So there's a lot done. One, I'm really proud of our public health lab. I want to just say it again, that we were like one of the first three in the country to be able to test for this.
This is wonderful, and I think it's a great public-private partnership where, thank you for spending your Saturday reaching out to our community. I know it's your day off, your family's in town. We welcome them to Coronado and you. And we're honored to have had this hour of your time today. I think we have one question, but I don't know if you have the answer if Mexico is committed.
And here, sorry, I
Okay.
was delayed in sending. So two things. One, Steve, I'll get to your question in 1 second. Before I do, one of the other studies I forgot to mention, I'll put the link to our whole website in the chat, but we have a studies page, but the federal government, ATSDR, they're doing what's called a public health assessment. And it does include sediment, because someone was asking about beach sand. So I just sent them an email asking, does sediment include sand? Probably not, but I just want to clarify. And then that'll be coming out actually hopefully later this year for air, and then they're going to do sediment and water and other stuff later. But then, Steve, to your question around has Mexico committed? So that set last link that I put, minute 333, that's that is gives you a good overview of what was agreed upon in the last agreement between U.S. and Mexico, and they're called minutes, is just what they officially call them. And then I'm trying to look at this link. For some reason, it's not working. Tell me if anyone it's working for anyone else. There's an EPA link too for um,
IBWC.
yeah, the IBWC link is not working for me. Like I click on it and it goes to the web page, but then when I click on the minute 333, it doesn't work. But here I'll give you the EPA
So
one.
let's see this one. Yeah, you're right. There, it's not working.
Yeah, so try this one, the EPA one. And EPA, so we meet every 2 weeks, just so you know. We, meaning the county public health, we facilitate a meeting with IBWC, with EPA, with our air district, with the state health department, and a couple others, the California EPA and others, where we just catch up on what folks are doing and stuff. So I'm very connected to these groups. But this last link hopefully should work. It works for me, and it talks about all of the different things. And I will say, I know there's always politics, and we serve the whole county. We're apolitical. Just want to be clear. But as the health department, right, we care about everyone in San Diego. But I did want to say though that under the previous administration, there was like 600 million or something that was gotten by our legislative by the California delegation for efforts related to Juana River. And then under the Trump administration, the EPA has actually been really proactive. They expanded the what do you call it, the sewage treatment plant to 35. I know they're doing more. They're really pushing Mexico. When there was that breakage a couple of weeks ago, they really pushed on them to fix that infrastructure issue with the pipe break as quickly as possible. So I know they're very proactive. I hope that whichever administration, right, that this should not be political. This is impacting like no one, like just to hear about that there's sewage, untreated sewage coming over the border is not something that I think people would expect in the U.S. In any community, right? And it shouldn't really no one in the world, right, should have to deal with this type of issue. And the fact that it's right here in our backyard is really sad, and hopefully that gets addressed regardless of whoever's in charge.
Well, thank you very, very much. And this has been a wonderful conversation, and we really, really appreciate your time. I'm going to go ahead and stop the recording and end the meeting for us. And again, we really appreciate your time.
Of course, thank you all, and great questions. I'm trying to capture them from the chat to make sure I follow up on someone.